Hello, I know exactly why you're here. You've just looked in your cat's mouth, and what you saw was, well, it was terrifying. Those angry red sores. I get it. But first, just take a deep breath. I'm going to walk you through exactly what this might be, and most importantly, what you need to do about it right now. When you see something like that, those raw, painful-looking ulcers, it's totally normal for your mind to just start racing. Panic sets in, and I'll bet the first question that just screamed through your head was, is this an emergency? Do I need to grab the carrier and rush to the vet right now? Your first thought might be, oh, it must just be really bad teeth. And that's a reasonable guess, but very often, this is actually a sign of something much, much deeper. It's a condition where your cat's own body, its own immune system, is actually the one causing all this damage. So let's get right to it. We're going to figure out if you need to be heading to the ER or if you can wait. I'm going to give you a super simple checklist to help you decide. And you're going to want to stick around because I'm also going to reveal the one hidden sign that most owners totally miss, and it's the sign that tells you to go to the vet now. Okay, so to really get a handle on what's going on in your cat's mouth, we have to look at the real cause. And what's so wild is that it's not really an infection, like you might think. It's actually a huge overreaction from your cat's own defense system. Right, so the fancy medical name for this is Feline Caudal Stomatitis, or FCS for short. But what does that actually mean? Well, it's not some outside bug or virus attacking the mouth. No, it's an inappropriate and, frankly, an enormous inflammatory response. To put it simply, your cat's body is fighting itself. Look, I know this sounds complicated, so let's try a simple analogy to make it all click. I want you to think of your cat's immune system like a really good home security alarm. Its whole job is to protect the house, your cat's body, from any real danger. But with stomatitis, that alarm system is, well, it's faulty. The sensitivity is cranked up to 100. So instead of going off for a burglar, it's calling in the entire SWAT team for a fly buzzing by the window. It's triggering this massive, painful 5-alarm fire response to something as harmless as a tiny bit of dental plaque. And that huge overreaction, that's what's causing all the inflammation and the awful pain you're seeing. Okay, let's get to the most important part of this whole thing. This is your red flag checklist. This is how you're going to decide what to do next. Let's break it down step by step. Step 1, you see some bad breath, maybe a little more drool than usual. Okay, at this point, you're just going to monitor closely. Watch them. Step 2, things are escalating. Now they're pawing at their mouth, maybe crying when they eat or yawn. That's your cue. It's time to call the vet and make an appointment. Now, step 3, this is the big one. If your cat is refusing to eat, if you've noticed they're losing weight, or if their coat looks messy because it's just too painful to groom, that is an emergency. I mean it. Stop everything and call your vet or an emergency clinic right away. So you're probably asking yourself, why my cat? And that's a fair question. The truth is, any cat can get this, but there are definitely a few things that can bump up the risk. We see this pop up in cats of all ages, from little kittens to our wise old seniors. But we have noticed a genetic link in some beautiful breeds like Siamese, Somalis, and Maine Coons. And this next part is really, really important. Cats that are already dealing with a virus that messes with their immune system, I'm talking about things like feline leukemia or FIV, they are unfortunately much more likely to develop this kind of massive overreaction in their mouths. Okay, I know that just thinking about a vet visit, especially an urgent one, can be super stressful for you and for your cat. So let's just demystify it. I'm going to walk you through exactly what's likely to happen so you can feel a little more prepared and a little less anxious. So the first thing your vet will do is try to get a good look inside the mouth. Now, if your cat's in a lot of pain, this might be tricky. That's why, to really see what's going on, they'll probably recommend an exam while your cat is safely under anesthesia. This is so important because it lets us do things like take dental x-rays to see under the gums and run some blood work, including that really crucial test for FELV and FIV. After we have all the pieces of the puzzle, your vet will talk you through everything and come up with a treatment plan together. And listen, I really want this next part to sink in. This is the most important takeaway. I know this all sounds really severe and the treatment might sound a bit intense, but there is some truly excellent news here. The outlook for these cats is actually really, really good. So here's the logic. If the immune system is freaking out about the plaque on the teeth, what's the most effective long-term fix? Well, it's to remove the teeth that the plaque is sticking to. This usually means extracting the premolars and molars in the back. Now, I know, I know that sounds really drastic, but trust me, by taking away the trigger, that crazy inflammation just goes away for most cats. They can finally live happy, comfortable lives again, usually without needing any more meds. All right, it's time to close the loop. Remember at the very beginning I promised you there was one hidden sign to look for? We've gone over the general symptoms, but this one specific clue is what really separates this serious condition from just, regular dental problems. So what is it? What is that number one red flag that tells you this is very likely that severe stomatitis we've been talking about? Here it is. The hidden sign isn't what you're seeing, but where you're seeing it. You need to look for inflammation that is behind the very last teeth, way in the back of the mouth, almost into the throat area. We have a medical name for it, of course, caudal mucositis, but all you need to remember is behind the last tooth. And this is just so critical. Why? Because regular old gum disease, even when it's bad, usually stays right around the teeth. The inflammation is on the gums next to the teeth. But when you see that angry redness spreading past the teeth, into the back of the throat, that is the classic calling card of stomatitis. That's the difference. So what do you do right now? Here's your immediate action plan. 1. If and only if it's safe and won't cause them pain, gently lift their lip and try to peek way back there. 2. Do not touch or poke those sores. That tissue is super fragile and will bleed very easily. And 3. Call your vet. Describe exactly what you saw and make sure to tell them if you saw that inflammation behind the very last teeth. And of course, please remember, this is all to help you understand what might be going on. It is absolutely not a substitute for getting professional veterinarian advice. Your veterinarian is always, always your best resource and your partner in keeping your best friend happy and healthy for a long, long time.